Hello guys, welcome back to another video. In today's video we are going to talk about different colors of period and what do they mean, or in case you see that color you should go and see the doctor. So young women who have just started their period often worry about changes in their color of their period blood. They want to know whether it is okay for blood to be brown or red. It is considered normal for blood to vary between shades of red and brown during the first few years after menarche, that is after starting period. Even in later years, as an adult, such colors are considered normal. The period blood can change during the same period cycle as well. For example, it can start out bright red in the beginning and change to a rusty brown at the end of the cycle. It can even start as a brown in the beginning and turn redder or more red towards the end of the period. Yeah. So why does period blood have different colors? The color of blood become darker the longer it stay inside the uterus and vagina, because it starts to react with the oxygen in the body. The reaction causes the color to get darker. The longer the blood stay inside the body, the darker it will get. So we have normal colors that someone should not worry about, and we are going to look at them. So it is normal to see period blood in shades of pink, red and brown. The shade can mean different things. Yeah, it is normal to see when your blood is pink, the period blood is pink, red, brown, but it can mean different things. So you have to know what does it mean when you see this period color. So when the period blood is pink blood is often seen at the time your period starts. At this stage, some of the fresh bright red blood may mix with the vaginal discharge, causing the color to be lighter and look pink. Vaginal discharge is a mixture of fluid and cell sheds by your vagina to keep your vagina healthy and moist and free from infection and irritation. If your period are light, the blood may also appear pink. I think you've gotten what I've said. So bright red color blood, as your uterus starts to actively shed blood during your period, you may notice the color is brighter. It's bright red. This just means that the blood is fresh and has not stayed in the uterus or in the vagina for a longer period of time. And the dark red blood simply means blood that has been in the vagina for longer, or it has been in the uterus for a longer period of time. It can be seen even with clots. The blood can come out with clots, and blood coming out with clots, it is always normal unless it is larger. Yeah, unless it is larger than normal. You know, something that is large or big. Yeah, so if you see the period comes out with clots, it's always normal, unless it is larger than what you think it is not normal. Yeah. The next thing, the next color is brown or black blood. Brown or black blood. These are colors. These are color variations seen in blood that has taken longer in the vagina to get out in the vagina. So black blood can be dark red or brown colored blood that appear black. Sometimes as your period come to an end, the darker blood can mix with the vaginal discharge and end up looking brown. So when you are approaching towards the end of the period, your period may appear darker or it may appear brownish. This is because sometimes it has mixed with the vaginal discharge, or maybe sometimes it has stayed longer in the uterus or in the vagina. So again, when period take longer than 7 days, or sometimes you need to change tampoo or pads after 1 hour or 2 hours, it is not normal. You are supposed also to consult your doctor. When you have severe cramps, kindly go and see your doctor. When you experience dizziness or feel lightning, headache, or maybe tired, you are supposed to consult your doctor. When you have chest pain, difficulty in breathing, or after period, you are supposed to consult your doctor because you might be having anemia. And also your menstrual blood contain larger clots. I said period coming out with clots, it's normal, but if it is larger, then you're supposed to go and see the doctor. You might be having other condition, maybe pelvic and inflammatory diseases, fibroids, or any other things. Also another time that you're supposed to consult your doctor, when you have spotting or bleeding anytime in the menstrual cycle, after and during your period, and also when your period cycle is shorter than 24 and 38 days, you're supposed also to consult with the health care provider. And another time that you're supposed to consult is when you have a period when you haven't have period for 3 months and you are not breastfeeding, and also you are not pregnant. Then you need to go and see gynecologist or anybody who can help you. Also, when your normal cycle has changed and they are now irregular, you're supposed to see. You might be having another problem. Also, when you haven't have the first period at the age of 15, if you have a girl child, your sister, your kid, anybody, any girl that has not started period at the age of 15, 16, this take that child to the clinic, to the gynecologist, so that you may know what might be causing the delay. Also, when you are bleeding after menopause usually start from 40s, let me say 40 and 45 to 55, it varies. So after 55, you if you are still seeing your period, then you are supposed to go and see your doctor, though it may take longer maybe to stop. And usually when sometimes when it's alarming, it's when you had stopped receiving your menses and then you are resumed after the age of that 55, then that one there might be a problem, so you're supposed to go and see the doctor. And then also when you have unusual vaginal discharge, smell, kindly go and see the gynecologist or the healthcare provider or the doctor, anybody that can give you way forward. Also, when you have severe fever during your periods, kindly do the necessary. I've reached the end of the video, so if you have not subscribed, kindly do so. Returning subscriber, thank you very much. Let's meet in the next video. Bye.